Let's bring back Mike Desjardins. He's the CEO of Anomaly, which uses AI to uncover costly defects in health payment data. Mike, I know we brought you back. We just saw you the other day, but on this issue in particular, what can you tell us? What are risk-adjusted payments?
Yeah, well, I think, when you're thinking about an issue like this, whenever you're talking about improper payments in healthcare, fraud, of course, is one, and your previous guest discussed it, and the Department of Justice is definitely get to the bottom of it. But there's also waste and abuse, of medical billing practices kind of in the incentives that exist. And the analogy I'd give is more like hiring an attorney to try to find every tax loophole you possibly can to pay as little in taxes as you possibly can. Not fraud. Not illegal, and United just happens to be quite good at that as it gets to risk adjustment. And all risk adjustment really means is looking at your panel of patients and diagnosing essentially what conditions that individual might have. And when we start talking about abuse in healthcare, what that basically means is whatever that risk adjustment score is related to diagnoses, are those diagnoses greater than maybe the procedures that patient is having, saying, hey, you might have diagnosed this, but you didn't treat it. So, really, should we be paying for it? I think that's where some of the questions come into the fore.
When you were on just a few days ago, we were talking about how to kind of find the real areas where you can make a difference in terms of spending, maybe some waste, maybe even some fraud. And you brought up Medicare Advantage, which this happens to circle around. Yeah. So does it surprise you that this area is under scrutiny?
No, it should be. I think Medicare Advantage is a great idea, and it can work, and it can lower costs, and I think that it should. And personally, I believe in the program, and I think that United Health and Humana and CVS, Aetna, and the other organizations that have an enormous chunk of that market need to be organizations that are driving us forward. I think the problem is it just isn't working right now. The goal of Medicare Advantage is to lower the overall expenditures of Medicare. And your previous guest cited the OIG report. The Congressional Payment Advisory Committee actually suggests that last year, Medicare Advantage overpaid 22% above Medicare to the tune of about $83 billion. And if that persists over the next 10 years, we're talking about, $1 trillion. And what's happening over that time period is Medicare Advantage is growing. It's 54% of Medicare eligible individuals now. In 10 years, it'll be more like 60%. And those folks are getting older. And as we know, care gets more expensive as they get older. So if the incentives continue to be, to find, these diagnoses for individuals, so that they can communicate to the government that they need more money to manage them because they're sicker, right, then there needs to be better oversight on, really are they, and how apples to apples, is this comparing across Medicare, and how these companies are managing patients more broadly. I mean, even in our own business, we don't work with the government. We work on behalf of health systems, but we're constantly asked by health systems to monitor, is Medicare Advantage paying the same as Medicare, because they're supposed to pay what Medicare pays, and oftentimes they don't. So there's lots of room to understand this data better to ensure, that Medicare is paying the right amount for Medicare Advantage.